Hello, good evening to everyone. My today's topic is bacterial corneal ulcer. As by the name, we can understand that corneal ulcer caused by bacteria. So, being the most anterior part of the eyeball, the cornea is exposed to atmosphere and hence prone to get infected easily. It may develop either by the failure of local ocular defense mechanism. Second can be the sometime local ocular predisposing diseases. Third is host immunity is compromised or virulent causative organism. Now etiology. In etiology there are two factors. First is damaged corneal epithelium and infection of the eroded area. Damaged corneal epithelium can be caused by the corneal abrasion, epithelial drying, necrosis of the epithelium, desquamation of the epithelial cells, and lastly, epithelial damage due to the trophic changes. Then pathogens. First is Neisseria gonorrhoeae, Corynebacteria diphtheria, Neisseria meningitis, Haemophilus aegyptis, and lastly the Listeria species. Source of infection is exogenous sources. In that, first comes congenital sac, lacrimal sac, foreign bodies, infected vegetative materials, and waterborne and airborne infections. Then causative agents. Causative agents are gram-positive and negative cocci, gram-positive and negative bacilli, and gram-positive filamentous bacteria. Then lastly the mycobacteria. But the most common bacteria are Staphylococcus, Streptococci, Pseudomonas, pneumonia, and Enterobacteriaceae. Lastly, the Neisseria. Then the stages of the bacterial corneal ulcer. There are four stages. First is the stage of progressive infiltration, stage of active ulceration, stage of regression, and stage of cicatrization. Then in the stage 1, it is characterized by the infiltration of polymorphonuclears, neutrophils, and lymphocytes into the epithelium. Subsequently, necrosis of the involved tissue may occur depending upon the virulence. Then the stage 2, it is the stage of active ulceration. It is results from the necrosis and sludging of the epithelium, Woman's membrane, and involved stroma. During this stage, there is an occurrence of hyperemia, which results into the accumulation of purulent exudate of the cornea. Then the second is the vascular congestion of the iris and the ciliary body. And the third is the ulceration may further progresses. Now the stage 3, that is the stage of regression. It is induced by the natural host defense mechanism, and the treatment which is augments the normal host response. A line of demarcation develops around the ulcer, which consists of leukocytes that neutralize and eventually phagocytes the offending organism and necrotic cellular debris. Then the final stage is the stage of cicatrization. It is a stage where the healing continues by progressive epithelialization, which forms a permanent covering. Beneath the epithelium, fibrous tissue is laid down partly by the corneal fibroblast and partly by the endothelial cells. The stroma thus thickens and fills in under the epithelium. Now the clinical features. In clinical features, symptoms are pain, watering of the eye, photophobia, blurring vision, and redness of the eye. Now the signs of the bacterial corneal ulcer. In that, first comes the swelling of the lid, blepharospasm moderate to severe, then conjunctival hyperemia and ciliary congestions. Fourth one is the corneal ulcer. Fifth is anterior chamber may or may not show pus. Iris becomes slightly muddy in color. Pupils may be small due to the associated toxin-induced iritis, and intraocular pressure may sometimes increased.